Welcome to another episode of The Breakdown. Oh, the healthcare, folks. This province with the healthcare, I don't even know anymore. And so today, because there's so much going on that's so terrible, we're going to have a conversation with somebody who's advocating for healthcare, publicly funded, publicly delivered healthcare, if I'm not speaking out of turn. He's with the organization Friends of Medicare. Very excited to welcome to the show today, Chris Gallaway. Chris, how are you doing today?
I'm doing good. How are you?
Well, just another day in the inferno. So literally,
Yes.
it's so smoky in Calgary. Where are you in the province?
I am in Edmonton, where for the first day in a long time, the heat is broken. So, it's better than it has been.
How's the smoke there? Are you guys doing
Yeah,
art in the air like we are down here?
pretty much. Still very smoky, but 10 degrees cooler. So we'll take what we can get at this point.
Every little bit counts. Um, I'm sure there's probably a way that we could tie raging wildfires and air quality. Actually, air quality we could very easily tie to healthcare. But we're here to talk about the healthcare situation in the province of Alberta. Before we get into that, I'm going to ask you to introduce yourself and the organization with whom you are affiliated, who is Chris Galloway. And as a follow-up, what is our Friends of Medicare?
Absolutely. So I'm Chris Gallaway, as you said. I'm the executive director at Friends of Medicare. I've been in this role for almost 3 years now. And for those who don't know, Friends of Medicare, we're a nonprofit, nonpartisan society here in Alberta. We're registered here in Alberta, and we've been around since 1979, really trying to strengthen and protect and improve public health care for all.
All right. So when you say nonpartisan, you're not out of a UPS post office box. And
No.
yeah, I was going to say it's pretty roomy for where you
Yeah.
are.
Yeah, we have an office, we have some staff, and we're fully donor run, right? We don't get government funding, we don't have corporate funding. It's Albertans and organizations coming together to fight for public health care is really why we exist and what we've been doing for decades here in this province.
If you wanted some government funding, I hear hockey tickets are the way to go.
Yeah, apparently. Just got to get some box seats and we'll be good to go.
Exactly. So the main reason why we reached out to you is because there's this thing happening in Airdrie. We just did an episode with a community advocate, a mom, an Airdronian. Love that that's the name of the folks that live there. That just sounds like something science fiction-y from the 60s. But an Airdronian Sarah Zagota about the new, he said cautiously, model, he said cautiously, of urgent care, he said cautiously, that is being proposed in the city of Airdrie. Now, I don't want to take up the space. So what is your awareness of what One Health is doing and how did we get to where we are?
Yeah, this is something we've been following closely for a while now. When the news first leaked that the current renovation project at the urgent care at the health center in Airdrie was on pause, when the Health Foundation shared that information, we started saying, "What the heck's going on here in Airdrie? Why is this pause? What is this proposal that they're considering?" And some of the news has leaked out since then. There's still a lot of confusion and a lot of questions about what's really being offered. We weren't able to make it to the sessions, but we've talked to many people who were there, including Sarah, about what they were told. We've talked to the Health Foundation and others about what they know. And it's concerning because what it looks like is we have One Health proposing a second urgent care center that would be a for profit run urgent care center attached to primary care and some other services, which would be a massive shift in how we deliver hospital and health center care in this province. That would be a huge change to privatize that. And it also isn't based on the needs in Airdrie. This is the biggest city in the province without a hospital. It's the largest population center that really is being underserved. And rather than doing any sort of health study like we've seen in other communities around needs and then making infrastructure decisions on that, we're seeing this proposal come up where the government's paying them to write a proposal to tell them to build this facility. It's not based on any sort of evidence. It's not based on what the Health Foundation's been calling for and so on. So it all seems kind of sketchy and behind closed doors, trying to get answers. We mostly have questions, and we're concerned about the road we seem to be on quite quickly, somewhat out of nowhere.
Okay. Lots to unpack there. So I'm going to try to back up a
Mhm.
little bit. Uh, From my understanding, and this is where I'm going to ask you to correct me if I'm wrong, from my understanding, the way things kind of played out is at like almost exactly the same time that those renovations for the existing facility were put on pause, there was you can't call it an RFP because, or request for proposal, because there was no request for proposal. It was just somebody said, "Hey, I'll tell you what, how about we give One Health $85,000 and have them put together a plan for how we could have a private for profit but publicly funded uh, urgent care being brought to Airdrie. And I think it's really important to make the distinction because a lot of people hear the word privatization and they think, oh, this is going to be a whole private thing you got to pay for to go to, and it's completely siloed off from the healthcare system. This isn't that. This is like the bastard love child of privatization and the public system in that the private corporation appears to be getting the all of the benefits of uh, leeching off of the public system. They're going to be provided the equipment, they're going to be provided the supplies. All they have to do is provide the staffing, and they get to walk away with the profit. Um, Tell me I'm wrong, please.
Well, we're not totally sure. It does sound like that's what's being proposed. When asked direct questions about it, there's a lot of kind of weaselly answers that we've heard about who would operate this, who would work in it, and those kind of questions. But you're right, there wasn't an RFP, a request for proposal, the usual process you might see. What we saw was a public project already announced and underway to renovate the Airdrie Health Center, and this proposal lobbied to the government that caused the government to pause that project and consider a private option instead. There was some public pushback, and they restarted the public proposal that was already underway, but then gave them some money to create a second proposal now for a second urgent care center in Airdrie, which wasn't based on any sort of need, right? We've talked about that. So it's this lobbying has led to this funding to write a proposal. And this One Health, along with a builder, already decided of who would build the facility, making a proposal. That's not how we would normally procure infrastructure in this province. It would be based on what community needs are for healthcare. It would be based on community consultation, and there would be some sort of request for proposal to builders to build this so we get a good deal on construction. And instead, it's kind of backwards. It's being lobbied to the government that they wanted to do this, and then they got some funding to justify why they would do it. It's totally backwards. It's not transparent, and that's what we've been saying throughout. This isn't accountable. It's not transparent. It's happening behind closed doors. And the only reason they've admitted that they had those public sessions is because the government told them they had to move forward. That's the only reason we found out any of these details. But then there's this slideshow that hasn't been shared publicly. We've seen photos of it. There's a proposal that isn't really shared publicly other than at the meetings. So there's a lot of kind of confusion and secrecy about what's really being proposed, who would own it, who would operate it, how's it funded. These are all questions we've been asking, and the government has hardly said a thing. They only admitted they'd paused the Airdrie Urgent Care project once it was leaked to the public. They've only admitted they funded this project's proposal once there was community meetings. So what's really happening between the health ministry, the government, and this One Health proposal? We don't know. It's all seems very, very sketchy and secretive, and not based on health needs. So, we're still watching, we're still asking questions, but it would be a massive shift in healthcare delivery if we had a private urgent care center operating in Alberta.
And I want to just touch on something because this was something that Sarah talked about in our conversation,
Mm-hmm.
and you just addressed it as well. It doesn't appear like Airdrie's wanted a hospital for a while, and it doesn't appear that the decision to bring in an urgent care is based on any kind of empirical data saying this is what the services that Airdronians love that word need. It's just well, we could do this too. I mean,
Yeah.
the from what Sarah described and from what the PowerPoint slides provide, this is a facility that would have at best 2 to 3 overnight beds. It would not have any surgical facilities. It would not have any in-depth obstetrical or labor and delivery facilities. So Airdrie still gets to drive somewhere to deliver their babies, especially if they're complicated. Um, eh, is that consistent with what your understanding is? Like it's just well, we understand that you really needed a pickup truck, but what if we got you a Civic? Like,
Uh, or two civics apparently.
yeah,
Um, and that's the history of this project. You know, Airdrie is the fifth largest population center city in our province. They don't have a hospital. They're growing exponentially. What's really needed is to talk about a hospital to serve that area. The urgent care project that's underway was kind of a compromise because that at the current site, that's all that can fit. They can renovate, they can make it better. It was supposed to be the short term thing while we talked about what the longer term solution is for Airdrie's healthcare. We think a hospital is needed. Obviously, given the population, that's not what's moving forward right now. No one anywhere was talking about two urgent care centers for the same community having an overlap of services. And it's, again, not based on any sort of needs or conversation with the community. You look at Beaumont here outside of Edmonton, you know, similar growing community just on the outskirts of the city. They've just done a comprehensive health needs study with funding from AHS and the community to talk about what services aren't there. They don't have a hospital, they don't even have an urgent care center, and they're this growing exponentially community. But they've done that work to look at what's needed to then talk about what solutions are there to provide services in the community. What will people have to go to Edmonton for? We're not seeing that in Airdrie. We're seeing this private proposal coming kind of out of nowhere, saying suddenly we need a second urgent care center because they couldn't get it on the other one, is what it feels like. So why is this happening? Why aren't we seeing a comprehensive look at like what's available in Airdrie, what needs are there, who's going from Airdrie to Calgary for what, and vice versa, because that also happens. People from Calgary go to Airdrie to access the urgent care. And then let's talk about it, because really what's needed is a hospital, clearly, right, of some sort. We need to improve healthcare in Airdrie. We shouldn't be sending everyone into emergency rooms and operating rooms in Calgary. But we're not having that conversation. Instead, we're talking about this one private proposal from One Health, which is also a membership clinic. So only One Health members will be able to access the primary care side. And right now, they don't have a membership fee, but we're seeing that trend where people are trying to charge these fees to get into those clinics too. So it's all laying the groundwork for something that we find quite concerning. And we would like to hear some answers actually from the health minister about why this is even being considered, what's the need that they're trying to address, and some answers on what's actually in this proposal, who's funding it, who's working there, who's profiting from this, how is it being delivered? Because this is a massive shift, and they're kind of treating it like no big deal because you know doctors' offices already operate in a similar way. It's just adding urgent care to that. There's a massive shift in healthcare delivery that we're very concerned about.
there's some implications of this model as well that I want to get into before we talk about the broader healthcare system and the concerns of Friends of Medicare in regards to the state of the Alberta healthcare system. But one of the things that struck me when I heard this model is, well, I mean, this isn't what Danielle Smith and the UCP proposed when they talked about breaking up AHS. They said that they were going to keep all the acute care stuff, which this would absolutely qualify as under Alberta Health Services. So bringing in a new private for-profit delivery using taxpayer dollars is not that. Aside from that, though, there are other areas of healthcare where we have seen the government historically go, "Hey, you know what? We need more hands on deck. What if we made a bunch more facilities and we used public money to fund them, but we allowed private companies to deliver them?" And I'm thinking of long-term care. And one of the problems that's been identified in the long-term care system, this is something that many physicians and many healthcare workers have spoken out about, is the notion that yes, there are beds available in the publicly funded long-term care system, but because those beds are being run by private companies who have a bottom line that they want to worry about, they tend to say to the more complex patients or the more complex people needing long-term care, "Hey, you know what? We're not the right fit for you." And this happens consistently. And this is one of the reasons that's been identified by multiple organizations for the bed blockage that we see inside of hospitals. So, have you seen anything to address similar concerns with this long-term care facility? Because off the top of my head, what I'm wondering is there any reason why this long-term care facility wouldn't be able to say to someone coming in the door who looks like they're complex or maybe they're gross? I don't know. And just go like, ah, you know what? We're not, can't really take care of you today. You should go to the old Airdrie urgent care because they'll be able to do a much better job. Is there any mechanism in this proposal that's been publicly made that says, yeah, these guys can't do that sort of patient picking?
We haven't seen anything. Well, we haven't seen the full proposal, but we haven't seen anything that would require, how that kind of transfer would work. You might see people shipped in an ambulance to an emergency room in Calgary. Hard to know, but you're right. With long-term care, there's no requirement for these facilities to take people if they think they can't provide the care that's needed. And there's a profit motive, right? And we see that with the surgical centers. They take the simplest, easiest surgeries, that kind of cream of the crop, and anything more complicated stays in the public healthcare system, or any complications that come from that end up back in the public healthcare system. So really, they're looking at doing profit with the easiest procedures possible. And we see that in seniors care. They want the lowest care needs possible for the residents because they can make more profit off of that. So that profit motive everywhere has that issue, right? Whether it would now be in an urgent care center, who knows what that might look like. We've never had that experience here of how patients would access a for-profit model, but it is a good question of how will they interact with the other pieces. And this really highlights the issue with the Alberta Health Services changes of splitting it up into primary care versus seniors care versus acute care. People's lives and health don't work that way. For one person, we have healthcare needs that overlap mental health and continuing care needs. So how do you split it all up in this way, where people are going to an urgent care center, but they also might have primary care needs, and who's operating what rules are you operating under, how are they interacting, who's ultimately responsible for you and your care? It creates those questions. And then if you add for-profit operators on top of that, it makes it very complicated for the patient to figure out how to access the best care possible. So, this is just one more layer of that. We haven't even seen how this primary care and acute care entities are going to roll out in the fall, let alone if we add a for-profit center underneath that in Airdrie.
I'm curious, one of the other section that I want to hit on with the Airdrie piece is um, I can't remember. I want to say it was like Freedom Talk or Freedom something. It was like Freedom Conference or they put freedom on everything these days as if it has anything to do with the actual thing. But Danielle Smith was a speaker at a conference a couple years ago. And in that conference, she was very animated. And she put forward a proposal for what her vision of healthcare, particularly in regards to AHS coming out of the COVID-19 pandemic, should look like. And she was very clear. She wanted to see private profitized operators providing acute care. She wanted to see private for-profit companies running organizations like hospitals. Are you concerned? Is Friends of Medicare concerned that this is the first step on that journey? Is this the first way that she gets her like proof of concept and then goes, ah ha ha, now we're going to sell the Peter Lougheed to Bob's Hospital Co.
Absolutely. It feels like one version of testing out how you could have a private operator, laying that groundwork. We've seen in the provincial budget, cutting of funding to things like the South Edmonton Hospital, other infrastructure projects where they're not moving them forward. Red Deer, the minister's riding where they are moving forward. They're talking about a public-private partnership as part of phase two for that. So they're looking at different ways to bring in private for-profit folks into our hospitals. So this could easily be a test case for that in Airdrie to say, what if we did it with urgent care? Then how do we move that into other hospital care and so on? That has been their goal throughout, right? We've been very vocal at Friends of Medicare that we have a government intent on breaking the healthcare system in order to privatize it off to for-profit entities. And they've been doing that over and over again, whether that's ambulance services or surgeries or the failed attempt with labs and Dynalife. now this urgent care center, everywhere they see an opportunity to bring in a for-profit provider that we're funding with taxpayer dollars, they're seizing that opportunity, trying it out. If it fails, like with Dynalife, we buy it back and we pay that expense for that as the taxpayers. The risk isn't on the operator, it's on us as we experiment with for-profit operators. So that is what they're queuing up with this AHS restructuring as well. Have these entities, and they really much see them as like contracting services underneath them, whether that's seniors care or so on. So we're not surprised to see a proposal like this as we move forward because, yeah, let's try it in Airdrie. Let's fund it with public tax dollars. Let's see how it works. And if the government likes it, expand it to other communities, like Beaumont or Leduc or wherever else that they're seeing healthcare needs. So it very much feels like a test case. I think that's why it's been so secretive, right? That they've had these meetings, they gave them some funding to make a proposal. Because if you don't push it publicly until the last minute, it's harder to push back against it. It kind of feels like that's what those community meetings were, and that we're already full steam ahead, where the government's clearly interested in this model that they've been lobbied to accept, uh, and they've given money to fund it, right? So why are they doing that? They're obviously already on board. So what is it going to look like? So yeah, you're right. They're testing out what they could do. What are the different opportunities? And they're going to use our tax dollars, our public money to pay to try this out. So, we're concerned because in the end, we always take the risk in terms of what care we get as Albertans, as well as the financial risk for if it doesn't work out, we're on the hook to pay for it anyways. Either way, these operators walk away and they've made their money.
Yeah, well, we certainly saw shades of that with the Dynalife scandal,
Yeah,
where they got arguably paid very, very well to walk away and sell everything back to the province that the province effectively gave to them.
gave to
Um,
them. Yeah.
is this why? I mean, and we're going to wander a little bit into speculative land, but we've heard rumors that the one of the goals of the current government is to move more of the privatization into the cancer care space. We've heard, obviously, Danielle Smith has been very clear. She loves the chartered surgeries or the privatized surgeries, usually orthopedic surgeries. She loves those ideas. And one of the things that we've been seeing over the last little while is cancer care sucks. Getting surgeries sucks. Is there a connection here, or should I switch out this bad boy for some tinfoil?
Yeah, it's the age old strategy, right? You let it break, you create an issue where people start complaining it's not meeting their needs, and then you offer up privatization as the solution to fix it, right? That's happened over decades. That's absolutely what's happened with hip and knee surgeries and these private surgical centers. Like, oh, the wait lists are too long. We're gonna fund with public dollars new for-profit surgical centers, and that's gonna fix the wait list. You're gonna get your care faster. And there's been evidence after evidence, including just in June, that shows that's not working. It's actually hurt our capacity to do surgeries. It's pulled surgeons and anesthesiologists and nurses out of our public hospitals. We've actually got fewer surgeries done in our public hospitals last year than the year before, and our wait lists aren't meeting the targets that the government claimed they would meet through this model, because that isn't actually their goal. Their goal isn't to solve the wait lists or the healthcare crisis. Their goal is to justify a for-profit model, giving these uh, good contracts. They've guaranteed volumes to their friends who are going to open these for-profit centers. Cancer care. Now we're seeing a lot of media about that, accessing cancer care, the delays, the struggle to access it. Well, guess what? It'd be very easy for the premier or the health minister to come forward and say, "Oh, we've got this idea. We're going to add some for-profit elements into cancer care to deal with the waits." That's what they always do to try to justify. They said the same about Dynalife, that they were going to address the lab issues by privatizing this contract. And then the waits got way worse to the point that even they had to admit it was a problem and buy it back. Right. So they're using these stories to justify this for profit model when really they're creating it through their decisions. They're letting the system fail so they can then justify why they need these contracts.
Okay. I want to explore, like, to me, there's two main problems with the privatization model, and I want to get your thoughts on those. The first one is, to me, like, I understand everybody's frustrated that, they know somebody or they hear these stories of people who desperately need care, whether it's orthopedic surgery or whether it's cancer care. And the system, because as you've just said, there is being deliberately hobbled, isn't able to provide that care in the timely manner that everybody wants it to be. So I understand that there's a lot of people who get really, really frustrated. They get really, really angry because, they're watching their parents or their grandmother, whoever, not be able to walk and not be able to participate in all of the family activities. Or heaven forbid, they've had delayed access to cancer care, and now the consequences are even more catastrophic. Um, it seems to me, though, that when we talk about the profitization of healthcare, there's two major problems. The first one to me is, if you're going to say we have, and I've used this example before on the show, but if you're going to say, hey, we have 1,000 people that need to get knee surgeries, I'm making stuff up now, by the way, but if we have 1,000 people who need to get knee surgeries, and we're going to give $100 million, again, making numbers up, to get these knee surgeries done. If you use a model that doesn't require profit, then all of the money will go towards that care. If you use a model that does require profit, then something has to give. And it's either the quality of care, the quality of instruments, the quality of diagnostics, rena. But something is going to be less in the private system, just because you can't do those things with the widgets with the same amount of money and still have profit. Am I getting that wrong?
That's so true. Seniors care is such a good example of that. These long-term care homes where the quality of care has dropped, the quality of the jobs in the care homes have dropped. You can look at the Auditor General reports from last year, looking at the long-term care in Alberta, and just how bad those are. Crappy jobs that pay poorly. They're not full time. They don't have sick days. There's all these structural issues that all then impact the care that seniors get living in those facilities, and it's all based on that profit model. But the other thing that happens, if not that, is we just end up paying more as taxpayers to get less, right? You look at the surgeries, and we don't have clear numbers for Alberta, but in Ontario we saw the numbers. They're paying up to 3 times as much for a private knee surgery as they cost them to do in a hospital. That's if you're a fiscal conservative, you shouldn't support this surgical model that we're implementing in Alberta. It's actually costing us more to do less, to not shorten the wait lists, and to give big profits to a few corporations who own these centers. And that's the truth of what's happened. Every time the government proposes these things, they say it's going to save us money, it's going to shorten wait lists, and we're going to have better care. And none of those three things ever come true once they implement it. It costs us more. The wait lists don't shrink, and the care gets worse as that profit motive chips away at what you're getting, because ultimately they're always trying to make a bit of money off the top. They're not operating a surgical center or a long-term care facility because they want to provide care. They're corporations who want to make profit, and that's what's operating in those buildings, right? And we have to remember that they're not doing it out of the goodwill that they're like, oh, I want more surgeries to get done because I care about people's hips and knees. They're doing it to make money for whoever owns the facility. So their motive is very different than what ours should be as the public healthcare system giving that money. And so, yeah, it's costing us more to do less, and we should actually call that out because the facts back that up.
Well, and you hit on another thing that's really, I think, important, because corporations do um, a very good job of marketing. Oh, but we care. We care so much.
Mm-hmm.
They do a very good job of branding. They got the nice pictures, and somebody's always got their arms around somebody else's, one hand on the shoulder thing. And they're all very supportive, and they're just caring so hard. But the reality is, any corporation has a fiduciary responsibility
Mm-hmm.
to make money, period. And if you ask a corporation, hey, would you rather make money or be nice to people? They'll say, ha ha ha, we're corporations. Of course we want to make the money. And so I think it's important for people to remember that, as much as there are organizations that do a very, very good job of marketing how much they just care, um, they will always care about their profit more because they have to. That's literally their jobs.
When it's easy to care when you're making a good profit. But what we see happen with Dynalife, when it wasn't working out how they wanted, when They tried to take the pension away from the workers, but failed. When the returns weren't what they wanted, they just throw it back to the public because they're not making a profit. So, it wasn't about doing labs and testing, it was about making money. And when they couldn't, we had to buy it back. And we've seen that in seniors care. Look to Ontario, just another one a couple weeks ago. These for profit long term care facilities who don't think they're making enough money anymore. So they're just stopping providing that care and they're leaving hundreds of people in Ontario without a bed in a long term care facility because they're shutting them down. We saw that with the Calgary Surgical Center years ago in Alberta. They're not making enough profit. It throws back onto the public system, and we have to clean up the mess and start providing that care. And they're leaving huge gaps when they walk away. There's no reason this urgent care center in Airdrie, if it went forward, these surgical centers or others couldn't suddenly say, we're out starting next month. We're not doing surgeries anymore. And we'd be left with this huge gap in our healthcare system to try to meet that need. Because, yeah, they care when they make money. That's why they exist. And it's not a dig on the people working there or the care they're providing. But when you have a corporation, increasingly it's corporations, large corporations too, who are owning these things, they're trying to make that return for their shareholders. What's happening in those facilities is just a means to get there. If they're not making the profit, it's all coming back on us.
The other piece, the other big problem, flaw, concern, I'm not sure what the word I should use is, that I think I see with these profitization models is if the government says to Bob's healthcare company. Hey Bob, ah, we need these knee surgeries done. The backlog, we don't have enough resources within the public healthcare system, so we want you to start. Here's $85,000. I don't know where I got that number from. We'd like you to put a proposal together to explain how you're going to solve the orthopedic knee surgery problem thing. Can you do that, Bob? And Bob goes, I like money. And
Yeah,
so he puts his proposal together. And then at some point in an environment where across Canada, it's fairly well documented that there is a crushing shortage of healthcare workers. Bob is going to look around and say, oh, I need to get me some surgeons and some nurses and some other things that work in healthcare. The only way that I'm going to be able to do that is if I pay them well, probably. And that will, to me, draw people who are providing those services in an already overwhelmed system already. You can't just like rub clay and water together and make a surgeon. You have to get that surgeon
exactly.
from somewhere. And so if you're pulling that surgeon out of the public system, then you're pulling that surgeon out of the public system. Um, whether it's a surgeon or a radiologist or an anesthesiologist or the reality is that when one of the defined problems is we don't have enough people to do the things, and you say, well, we're going to get Bob to do the things, now you're further hobbling the public system. Am I getting that wrong, or is that a real concern?
Absolutely. And that is the concern in Alberta and across the country is we're in a healthcare human resources crisis. It's a staffing crisis. We don't have the skilled healthcare workers that we need to keep the system going, let alone for what we need for a growing population. And when we do these privatization schemes, we're splitting up the workforce even more and we're making it worse. So, you talked about the attracting folks to the surgical centers. They don't even necessarily have to have a better benefits or a better pay. The folks working in our hospitals, we hear, especially from nurses and others, that they're so burnt out. They're always short staffed. They're getting called in, they're having forced overtime. Why wouldn't you consider a 9 to 5 job in a surgical center that only operates on limited hours just for the work life balance piece, let alone the bigger piece? So there's ways they can attract folks out. And, we keep saying over and over, building a new giant surgical center on the south end of Edmonton. There's this new big for profit center there. Doesn't create another surgeon. It doesn't create another anesthesiologist, etc. It just moves them around, and we're not making these decisions with the workforce lens. So we're making it worse for ourselves. And it's actually more than that. We have this perverse incentive now to have folks working there because the contracts are baked in a way that benefits the for-profit provider over the public. We've given guaranteed volumes, so it's actually, if there's only one anesthesiologist, that can work that day, it's in our benefit for them to go to the private center and get those surgeries done because we're paying for them either way because we've baked that into the contract. We've completely undermined our own capacity in the public system. And all those contracts look like that. We look at fiscal responsibility. Dynalife got a sweetheart deal where they got the so-called profitable community labs and didn't have to take on that other work. And even then, it didn't work for them in the end. They couldn't get the staff they needed. They couldn't operate it because we're blowing up our own workforce by contracting out more and more rather than looking at a plan for how we retain people, recruit them, train them, actually have them working in the system. So the way we're doing the contracts is actually making it even worse for us as the public. But you're right, the workforce piece is the real issue. And every decision we make in healthcare should have that workforce lens. But we haven't done that work in Alberta. We haven't mapped out the workforce. We haven't done workforce planning. We're not looking at retention, how we keep people. We're just making one-off decisions where, yeah, we're going to have this surgical center. Oh, yeah, well, now we'll look at this urgent care center in Airdrie. How are we going to staff two urgent care centers in Airdrie? Is that the need? Do we have the workforce for that? We're not looking at those issues when we're making decisions because the government isn't looking at that global picture of the workforce. They're just looking at everything as a one-off contract, a one-off decision, and that's just escalating the problem as we go forward.
It also seems to me, and this is where I want to get your take on it. It also seems to me that there's not an effective firewall between the various different mechanisms by which we get healthcare workers. We've seen allegations out of Edmonton that a physician who was wanting to start a private clinic was leveraging his leadership role within the public health system to say, yeah, you really do want to come work for me, especially if you want to get any advancement in this environment. And obviously, that would appear to most reasonable people, I would like to think, to be a massive conflict of interest. But even, these private clinics, I believe I read somewhere, there's my hedging, that One Health operates as a teaching clinic. And so, one of the questions that I think has to be asked is if you're having all of these profitized healthcare delivery models and they are also offering up teaching spaces, then there's to me a risk that they're going to say to the new physicians or the new nurses or the hey, instead of going to that shitty public health system, why don't you just come and work for us? You already know us, we're cool. We've got the Keurig machine in the back with the Dr. Pepper, you'd love it. Is that a real concern, or am I just going too far down a rabbit hole?
Well, we are creating competition for ourselves by doing this, and you're really identifying that, right? If we're desperate to recruit new healthcare workers into the system, we can't staff what we need. Folks are going through training at universities. We should be doing everything we can to keep them in Alberta, to get them into the public healthcare system, and instead we're like creating incentives for them to not come into the system. Even things like the travel nurses, those agencies that pay well above what nurses who work for Alberta Health Services make to go work in the same facilities, they're actively poaching nurses out of the public health care system. And we're signing contracts with these agencies, the government is, to come into our hospitals and work next to folks who are getting paid less than them to be there. So we're creating all the reverse incentives to actually pull people out in all sorts of different ways rather than trying to figure out how we retain people and then grow the workforce. So, we're making decisions that prioritize profit for certain people while undermining our public healthcare workforce. So, over and over, we're seeing that. It's frustrating to see. And really, what we've been calling for a long time is a workforce plan for Alberta healthcare, where the government actually brings everyone together, bring the employers, the associations, the unions, the post-secondary institutions, look at what we have and what we need, and actually plan for that instead of making an announcement here or there, signing a contract here or there. We even saw with the nurse practitioner announcement, allowing nurse practitioners to have their own clinics, which, we should be using nurse practitioners more. But there was no associated training funding, so we could train more nurse practitioners. So we're just moving nurse practitioners around to have clinics that they're already working somewhere. Where is that? What's the impact of that? We're not looking at decisions in that way. We're not connecting it to training. We're just claiming that they're the magic bullet solution in the government releases when they make them without actually looking at the system as a whole. So, The workforce, over and over, you'll hear, if you follow Friends of Medicare, us talking about the workforce and healthcare and how we're not looking at it seriously. All of these are examples of how that's true and how our government really needs to take some leadership over healthcare human resources and make decisions based on that.
Yeah, it's wild because it seems like with the way that we're incentivizing things, we're saying to people like, "Hey, how would you feel about punching me in the face?" And when they're like,
Mm-hmm.
"I don't know, how about if we paid you to punch us in the face?" Like it's just it's so
Yeah.
so backwards to me. What are the other things that you want people to know? What are the other things that are on your radar right now?
Well, I think, not to sound too depressing, but our public healthcare system is in a really, really scary place right now with the closures we're seeing, the staffing issues we're seeing. I think Albertans really, if they care about public healthcare, this is the moment to speak up and say something because the folks who want to make money off of health are circling everywhere. They see a huge opportunity, whether it's urgent care center in Airdrie or TELUS Health or Shoppers. There's all these huge entities that are trying to find every little piece of the system that they can make a buck off of to get in there, to get a contract or to start charging fees for access because they see that that's the issue. Folks are struggling to access the healthcare they need. They're all looking for ways they can make money off of that concern. And our government's helping facilitate that in many cases, right? So we're seeing that with the membership fees popping up for health clinics, but you can go to Shoppers and pay directly for lab tests in certain locations. There's all these different ways that they're looking for ways to make money off of our health. And if we don't speak up now, they're going to gobble it all up so that there's really nothing left of the public healthcare system other than these entities contracting out work. That's the road we're on. That's the road the government's on. And so, that's very ominous sounding, but this is kind of the moment where folks who want to make a lot of money off of us see that opportunity and they're going to seize it and they're going to have good contracts to seize it if we don't speak up and say, hey, the real issue is access, the real issue is the workforce, and we want our government to work on that and actually ensure we have public health care that's equal access for all.
All right. People want to keep up with Friends of Medicare. Where do they, what socials? There's so many now.
Mm-hmm.
Where's the best places? Where's the best places to know what y'all are up to?
Well, they can go to friendsofmedicare.org if they want to go to the website. We're on Facebook, we're on Instagram, we're on X for whatever that's worth these days. You see lots of trolls there as well, of course, nowadays. But yeah, we're on all the platforms and we have an email list if folks want to get updates directly as well.
I still call it Twitter.
Mm-hmm.
I find once you get your block list up to about 6,000, it's a delightful little discourse.
That's the threshold. Okay, well, we'll aim for that.
It's wild, man. Like when we first started this show, we had up until the UCP leadership race, actually, our block list was, I think, 13 or 14 people. And
Yeah.
then the UCP leadership race, and it's almost as if somebody's paying for bot farms to come and
Mm-hmm.
troll. It's the strangest thing. But yeah, once we broke past 6,000, then things got much better. So.
Yeah. It feels like a lot of work to get there.
Well, it's just consistency. Like you see this person saying, well, yeah, Polyev's going to save everybody, or using junior high insults and hide block. And then,
And they have 7 followers or whatever. Yeah.
yeah, and there's something that all seven of those followers have in common. You know what I mean?
Yeah.
Um, Chris, I want to thank you so much for taking the time to chat today. Because I don't know how anyone can argue otherwise. There is a seismic push to change the shape of the way that healthcare is delivered, and that will have a massive impact on the quality of how healthcare is delivered. So I really appreciate you taking the time to have this conversation and try to shine some light on that.
Yeah, it's happening very quickly. So thanks for reaching out and taking some time to talk about it today.
Awesome. Thank you.
And that's it for another episode of The Breakdown. As always, if you appreciate the kind of content that we're trying to produce here, we would love nothing more than if you thought about signing up to be one of our Patreon sponsors at www.patreon.com/thebreakdownab, where for just the price of a fancy cup of coffee a month, you can help us continue to produce this kind of content. Whether you're listening to the audio version of the podcast, in which case maybe leave a review and a rating, or whether you're watching it on one of our streaming platforms, we want to say a big thank you to everybody who is part of the Breakdown's audience. And as always, take care of each other and keep the conversation going.